So today there are 147 new cases in the community. Of these, 131 are in Auckland, 14 in Waikato, and 2 are in Northland. We've also got 2 cases in returnees in managed isolation. Sadly reporting a sudden death of a man in his 60s who had COVID-19 overnight. He was isolating at home in Glen Eden in Auckland. Now, the cause of death will be looked into by the coroner, including whether it was COVID-related. Any deaths that could be COVID-19 related are fully investigated, whether they occur at home or in the hospital setting. Obviously, our thoughts are very much with this man's family and friends at what will be a stressful time. In terms of hospitalisations, we have 81 people in hospital with COVID-19, 11 are in ICU or a high dependency unit, and they're all in the Auckland region. Further on Auckland, our team up there has identified 6 suburbs of concern because there is a higher risk of there being unidentified cases and transmission there, and so anyone in the suburbs of Ranui, Sunnyvale, Kelston, Birkdale, Manurewa and Mangere are encouraged, if you have any symptoms at all, whether you are vaccinated or not, please go and get a test and stay home until you receive a negative result. Moving down to the Waikato, as I said, 14 new cases there. Of these, 10 are in Otorohanga. That includes 6 in one household who were known contacts. 3 of today's cases there are from Hamilton and 1 in Ngarawahia. Some of those cases are as yet unlinked, but interviews are underway at the moment. There is testing widely available through Hamilton and across the Waikato again today. And there was 1 location of interest identified yesterday, and that is the base in Hamilton, so please check the Ministry website to look at the time and date where that exposure event was and look at the instructions there. Up to Northland, the 2 cases to report, both in the same household in Dargaville, and there are probable links already known to cases in Auckland that have been identified there. One of those cases is a child under 1, and this highlights that COVID can affect anyone of any age, and all the more reason for us to think seriously about vaccination, because it's one of the best ways to protect our tamariki.
And looking forward both towards the end of this year and into next year, we do want to ensure that we're providing as much certainty as possible for students, teachers, their whānau and their communities. Nobody wants to be in a situation heading into the summer break or ahead of term 1 next year where we're still unsure around how children and young people can return to school, kura and early learning safely. Today I'm outlining a plan to return to face-to-face learning this year. That will look slightly different to what we're used to. We'll all need to become comfortable with the idea, and we'll all need to get used to public health measures that will now be in place. For years 9 and 10, they'll return to school, joining those students where there are already year 11 and to 13 students back, preparing for their exams. That can happen from the 17th of November. For children and young people in years 1 to 8, students will also be able to return from that date part-time. That can include alternating days or half days through year levels or through whānau groupings. Full-time learning will continue on site for the students whose parents have needed it. For example, when they're going to work, those students are already back full-time now. Each school or kura will get a bit of flexibility to decide what works best for their learners and for their community, and they'll have full support from the Ministry of Education's regional directors. Schools will be in touch with their communities directly about how they are going to be structuring the return to school and what that means for their communities. Public health advice supports a return to on-site learning. Some further measures do need to be put in place, and they will be. That includes mask wearing for year 4 and up, ventilating classrooms, which will become a lot easier over the summer break, limiting the number of students on site, and making sure that groups of children distance from each other. The health advice also tells us that in other countries, out-of-school activities actually create a greater risk of transmission than what happens in a place of learning. So what's clear is that the risks of reopening schools are outweighed by the benefits of kids re-engaging in their learning in a face-to-face context. The balance of risk is shifting as we continue to see vaccination rates throughout the community increasing. Auckland is already at more than 90% first doses, and that does provide a good layer of protection. When schools go back next week, all teachers on site will have had to have at least one dose of the vaccine, and that further helps to reduce the risk of transmission. The ongoing restrictions have been incredibly hard on children and young people, and of course their families as well. And returning to school, interacting with their friends and their teachers, and getting back to face-to-face learning will have a positive impact on their well-being as well as their learning as they head towards the Christmas break. We also know that COVID-19 has been pretty tough on the staff working in our schools, our kura and our early learning services. And we know that they'll need a bit of time to build back from that disruption and have a bit of time to focus on their own professional development as they and their students to make sure that they've got the best chance of success. So the government's decided to ease the requirements on schools for the National Curriculum and Assessment Program changes that we are making to ensure that they've got time and space to manage the return to school following the disruptions caused by COVID-19. So that means resetting the timelines for the refresh of the curriculum, the introduction of New Zealand history, and the NCEA change program. For early learning services, it means delaying the consultation on gazetting of the early childhood curriculum Te Whariki. These changes, these programs are still critical, and they're still very important parts of the government's work in the education space. But they do require considerable effort, and we acknowledge that between now and the end of the year, we need our schools and our teachers and our early learning services focused on supporting a return to learning. So I believe that time spent reconnecting with communities, focusing on well-being, and of course teaching and learning, will serve our communities best over the next few months, and that's what they should be focused on.
Just an update on our modelling. Last Monday, 1st of November, I showed some modelling from Dr. Gary Jackson, one of the team up in Auckland, regarding forecast case numbers, hospitalisations and ICU numbers, as well as the R value. And that modelling had forecast around 200 cases per day by the end of this month in Auckland, around 1,400 cases a week, based on median numbers. And if we look back at cases last week, as I mentioned on Monday, they were virtually spot on with what the model had forecast in terms of case numbers. Hospitalisations were somewhat higher, but ICU numbers a bit lower. And just to show that by the end of November, to reiterate, the modelling predicts each week around 150 new hospitalisations and around 11 ICU admissions. But I do want to put that in context. There are more than 1,700 hospital beds across Auckland and over 100 ICU beds. ICU bed capacity does change on a daily basis depending on what the local needs might be, planning and staffing, and so those numbers can be increased both in Auckland and around the country. It's important to know the hospitals in Auckland will have and do have capacity, so anyone who needs care for any reason, do not delay in seeking it. The hospitals are safe. However, we do want to limit the impact of COVID on our hospital system and indeed our wider health system. Two things people can do there are to be vaccinated and secondly, to abide by COVID-19 restrictions. And most importantly, if you are unwell, don't go out. Two vaccine updates. First around an update on our portfolio. As you know, we have the 4 vaccines in our portfolio, 3 of which have had provisional approval from MedSafe. To date, our program has focused on the rollout of the Pfizer vaccine with a high level of success to date and ongoing progress. That will continue to be the primary vaccine available in New Zealand. However, we know there is a small number of people in New Zealand who cannot have the Pfizer vaccine, and so we think it is appropriate to have an option available for them. So those are people who cannot have Pfizer for medical reasons, and that's likely to be just a few hundred people. There are other people who may have a different reason for wanting another option, and that includes people who are required under an order to be vaccinated to be able to continue in their work. We are requiring them to be vaccinated to protect themselves and the people they work with, which might be patients in a hospital setting or, of course, children in school settings. So on the basis of advice from our technical advisory group and some work from our vaccines team, we are in a position to be able to make AstraZeneca COVID-19 vaccine available as a second option for people aged 18 and over. And like the Pfizer vaccine, this will be a 2-dose course. We'll have more details about this next week, including the timing. The availability is likely to be in late November, But there is quite a lot of work to ensure that the workforce is trained to administer a second vaccine, that clinics are available to do so, obviously cold storage and logistics are in place for that. So there's some work to do there, but I'm just signalling that that's an option that will be available. Not for everybody. Again, those two groups, those who cannot have a Pfizer vaccine and those who are required to be vaccinated but are not prepared to have an mRNA vaccine, but may be willing to have the AstraZeneca vaccine. It won't be available as widely as the Pfizer vaccine, and I do want to reiterate that Pfizer remains, for good reasons and based on scientific advice, the mainstay of our vaccination program. And continuing with Pfizer, as you will know, on Monday, MedSafe approved a third booster dose of the Pfizer vaccine for people aged 18 and over who've already had the full 2-dose course, and recommended that that be for a minimum of 6 months since their second dose. I've now received advice from the COVID vaccination technical advisory group with some recommendations on priorities for boosters and how that should be rolled out, and we'll be providing advice through to our group of vaccine ministers on Friday. But again, we are getting closer to being able to roll out that booster program, starting with those who were vaccinated first and who are at the highest risk, which is our healthcare staff and our people 65 and over, and those who were vaccinated early. Further details next week, once ministers have made a final decision. But again, we're anticipating late November as the timing when that program will get underway. And just to reiterate that this is separate from the third primary dose that has already been available for people with severe immunocompromise and has been rolled out already successfully.